Hi, I'm Dr. John Van Wagoner. I wanted to talk to you about skin testing. Skin testing is a method that we use as allergists to determine what you're allergic to. It's a safe, FDA-approved method for allergists to figure out what you may in fact be allergic to. It involves the application of the allergen of question to the top surface of your skin. And what happens is, if your body has developed IgE-mediated antibodies or allergic antibodies against the allergen of question, your skin cells that live on the top of your skin will also have those IgE-mediated antibodies directed against the allergen of choice. And so the great thing about skin testing is that we can skin test either your forearm or your back and be able to look inside to see what in fact you are allergic to. And so it's very valuable, and it's very timely, and it gives us very accurate results. In fact, a skin test has a very high negative predictive value. What does that mean? That means if I get a negative result to a skin test to a certain allergen, I'm usually very confident that that is truly negative and that it's not a false negative. So we can usually rely very highly on negative skin tests and ruling out allergens that you may in fact be allergic to. The positive predictive value, on the other hand, is not that great. And what that means is that we cannot always rely upon a positive result indicating true allergy to the patient. So typically what I tell patients who come in for a skin test is that I really need two things before I can tell you that you're allergic to the thing of question or the allergen of question. Number one is, most important, is that when you get exposed to either that allergen or that food that we're testing against, you have seen or witnessed some symptoms or signs that are consistent with what we see with allergy. For instance, people that have hay fever. Typically what they'll tell me is, yeah, Dr. John or Dr. Van Wagoner, usually during the spring, I get stuffy and sneezy and itchy and red with regards to my eyes, or watery. I have some classic symptoms during springtime. So with that history, I'll be somewhat suspicious that you may be allergic to the trees that pollinate in the spring. Grasses also pollinate in the spring. And so sometimes it's kind of difficult to understand, is it the trees that are getting you, or is it the grass that's bothering you? So typically what I would do is I would maybe skin test you to some of the trees that pollinate in the springtime, or some of the grasses that pollinate in the spring and summertime, and then we'd see what happens on your skin as a result of the skin test result. And the great thing about the skin test is it gives me a result that's pretty accurate within about 20 minutes. Now if the skin test is positive, plus you give me this history that you have symptoms during that season, then typically 2 and 2 make 4, and this may in fact be accurate and may indicate really what you're truly allergic to. Now here's another instance where the skin test may not be helpful. For instance, I may have a patient that comes in to tell me that, I ask them, do you have any pets, and do the pets bother you? And they go, no, John, I sleep with cats, and cats don't bother me at all. I'm with them all the time, and I have no symptoms whatsoever. And for instance, maybe I skin test them to cat just to kind of make sure. Maybe I don't believe them, or we're doing a big screen and cat's on there. But cat is positive. So the skin test is positive to cat, but the patient tells me cats don't bother them. In that situation, that may in fact be what we call a false positive on the skin test. And we see that sometimes. So like I told you initially at the top of the discussion today, I treat the patient, not the test. I use testing to help me confirm or corroborate the history. Let me show you at the very end what a skin test is like. Now typically we use what we call a multi-prong device, and they come from different manufacturers, but they're sterile and they're in a very convenient package that my nurses use. And so they'll just open up the package and they'll take out the skin test device. Now I also have a tray of what we call serums or allergens that we use to skin test with. And what happens is this little skin test device will be placed into those serums and then taken out. And each allergen will be addressed to each different prong. So that may have cat on that may have ragweed, that may have dust mite, may have milk, maybe a mold. A lot of other different things may be tested against. But after this is dipped into the wells of the different liquids that have the allergens of choice, these liquids are now going to be on the surface of these prong device. Now the benefit of doing skin testing is there's no shot, there's no needle, and there's no blood with its administration. But typically either on your forearm or on your back, after the prong has been placed in the serums, we'll take it out and then we'll just put it on your back or your arm, and we kind of place it like this and rotate a little bit and then come back off. Now obviously I did it on my coat jacket, but this would be on my forearm, on the skin, or on the back. And typically that's all that's needed. And so a very minute portion of the allergen will be placed underneath the skin after the application of the device, and then my nurses know where each thing has been placed, and I do as well, and we mark the areas so we know which thing we tested against. And then after 20 minutes we'll come in and read the device or read the test. And typically if you're allergic to something I tested you to, you'll get a big red bump that's developed at the place of the application. If you're not allergic, nothing will happen. Now we'll call that bump a hive, or what we call a wheal, and there may be a little bit of red flare around it. Those wheals and flares may last 20 to 30 minutes at the most. Typically we'll give the patient some oral antihistamine after the test is done, or we'll put some anti-itch cream on top of the reaction after it's been read. And typically it goes away within 30 minutes to an hour at the most. But it's a very safe, easy, FDA approved way that we can look to see what you're allergic to. I also sometimes get a question of what's better, a skin test or a blood test when it comes to determining what I'm allergic to. Really the best result I can give patients is, from my experience and from other people that are smarter than me, skin testing tends to be a little bit more clinically relevant than blood testing. Sometimes I can't skin test someone because you can't get off your antihistamines or you're on some other medicines for another problem that would interfere with our ability to do a skin test. And so in those situations I have to rely upon a blood test that's not interfered with by any medication you may be on. So there are certain situations where I may not even do a skin test because I can't get you off some certain medicines, or the application, or at least the indication, only accounts for doing a blood test to look and see what you're allergic to. But in most situations, a skin test is really appropriate and probably preferred. Now, hopefully this is a very good short summary of what skin testing is and how it's done and some of the reliability results that we get from them. If you have any other further questions or concerns, I look forward to talking to you in my office. Please schedule a visit and we can talk about the utility and the pros and cons of doing skin testing for you.